morning to you.
Phlebology as a field is constantly evolving, and thanks to the great variety of new technologies available, specialists are able to provide more efficient therapies. In your opinion, what aspects provide the greatest innovations?
Well, as you said, there is a continuous proliferation of techniques to treat superficial and deep venous disease. And what we need is symposia like Vein in Venice that people can easily understand which are the weapons today to combat the disease. And of course, if we can do a combination of these techniques, the era of the one technique to treat all is terminated. And I think this is mandatory for all the young surgeons to know how to deliver new techniques to all the patients. So we need really to understand with this symposia the importance of the innovation.
How crucial is it to this day to continuously exchange experiences among the scientific community in order to improve?
Yes, well, this is the exact place where surgeons, where angiologists will stay together, will discuss, will lead together, will exchange opinions. So it is very important to make, the climate of a collaboration and to introduce one to the other the tips and the expertise that he has done in his own field. And I think also this is the correct place. I saw many good surgeons trying to share tips and tricks with all the colleagues. So this is very important, not also for us, but for the community.
What is your opinion on the use of the newest technology, such as the increasingly widespread use of AI, in terms of cost effectiveness?
Yes. Now, we are at the beginning of this era of the intelligent artificial intelligence, and the most important thing that I have seen the last 12, 20 months is the use of artificial intelligence in detecting deep venous thrombosis. Probably it is crucial to understand immediately if you have a deep vein thrombosis because it is life-threatening. In surgery, we can use artificial intelligence because it helps us to making better an operation. And now we saw some lasers coming out with the use of artificial intelligence that they know how to retract a fiber, to standardize energy, and whatever it is. But we are at the beginning. I think the most important thing is the experience that the surgeon has, and he has to lead artificial intelligence in the field that they are gray zones and we need help. Okay.
Can we talk about your latest work, the one that you introduced during this day?
Yes, we have just finished an excellent workshop on direct puncture of glue for treating recurrences and small vein segments. And I think it was a very engaging and interesting discussion with the faculty and also with our colleagues that were attending. And many good things came of this collaboration and exchanging of opinions. And the main thing is that there is no one technique that fits all, but there are too many techniques and a combination of techniques that people have to use if they want to make perfect an operation. And of course, expertise, the skilled hands is something that is going on with accumulating experience. So a combination of experience and all these devices, I think, will make the difference in the future.
What do you think was most interesting in today's event, and what aspects would you suggest we give more emphasis in the future?
Well, what is very important in Vein in Venice is that it's not a classic symposium that people come, give a talk, and then they go away. There is a lot of space for interaction among colleagues. And I have to underline this because I'm frequent to go aboard and see a 3-minute talk. But people cannot understand. It is a symposia for experts. The right and correct thing that we're doing here in Venice is teaching also to the people that want to come more towards to the vein surgery. And vein operations nowadays are proliferating. It is the most exciting thing in vascular surgery. If you only see 70% of the operations are in venous disease, and now we're coming up with the deep venous system. So I think there will be more and more engagement in this. Of course, I heard that it was everything sold out, and I saw many people. So you have to find a place because it is a very, very interesting symposium.